Good morning, good afternoon, or good evening, depending on where you join us from in the world. We are internationally recognized as Voice of Men 360, and I am your vice president for Voice of Men 360. I'm also the host of a show called Open Up. I'm RJ Horner. Nice to meet you. Thank you for joining us today for this special live talk show on prostate cancer, the nuts and bolts. Again, thank you for joining us on behalf of myself and the Voice of Men 360 team. We are Voice of Men 360, a not-for-profit organization founded in 2020 and based in Toronto, Canada. We were born out of seeing a tremendous need and stepping up to help provide services for our men and boys to help overcome their life challenges. We're part of International Men's Day, and International Men's Day has been serving for over 21 years so far and is now represented in 90 countries around the world, joining to do various activities regularly. International Men's Day follows 6 pillars which represent the overall well-being of boys and men, and we follow in those same footsteps here. That's why we want to have this special show on prostate cancer. September is Prostate Cancer Awareness Month, and Voice of Men 360 want to create awareness and share some important information with our community on this important topic for men. So before I introduce our guest today, we want to remind you that Voice of Men 360's mission is always delivered with good faith towards peaceful harmony. The views and opinions expressed in today's episodes are those of our speakers and do not represent Voice of Men 360. Our organization engages in discussion forums to offer inspiration and create awareness to the issues of men who wish to overcome their life challenges. We're not providing medical or therapeutic advice. Should you require that type of assistance, we recommend you contact a medical professional immediately. If you have questions or concerns about today's episodes or any Voice of Men 360 content, please email us info@voiceofmen360.com. So please today welcome our special guest on this topic, Dr. Sati Persaud. He completed his doctorate of medicine in urology in 2015. He returned to Trinidad in 2018 and is a consultant based at the San Fernando General Hospital. He's a lecturer in urology at the University of West Indies and director of residency in urology, which trains local urologists. He's a Caribbean fellow of the Caribbean College of Surgeons and the Royal College of Surgeons of England. He's a member of the International Society of Urology and the American Urology Association. He served on programs for Developing World Committee and the SIU Academy, and currently sits on the Endourology Committee as the SIU Academy. He's a vice president of Caribbean Urological Association. Dr. Persaud has authored numerous research papers in urology. Thank you for joining us. You seem like the perfect professional to discuss this topic with. I saw urology several times in your credentials. That is the topic of, first of all, it's a hard word to say, and one that men don't like to mention at all. So we're going to have this discussion with Dr. Sati Persaud. Thank you for joining us this morning.
Hi, how are you? Happy to be here. I mean, it's Prostate Cancer Awareness Month. We do need to do just that. We need to raise awareness, and we need to kind of destigmatize screening and men's health in general. I mean, men are it's probably the same where you are, but here we have this ostrich behavior. We kind of duck our head in the sand and hope they will go away. And we really don't realize that sometimes a simple thing done early can save so much trouble down the road. Prostate cancer is really a treatable cancer, and screening could prevent, catastrophes later in life. So I think we need to get a message out there. We need to really kind of dispel the stigma that surrounds prostate cancer screening, a lot of men's health issues, erectile dysfunction, and so on.
Yeah. And I think, I'm a 48-year-old man, which means now I'm at the stage where I need to start worrying about this. This is a topic that's going to be prevalent in my life for years to come. And yet it's a topic I would love to avoid. You're right, like you mentioned. But, we all know the test for prostate cancer. At 15 years old, we know the test, and none of us want to have it done to us. But yet we must. We need to learn about these things. We need to remove that stigmatism in order for men to just seek the treatment they need, right?
Yeah. So, I mean, the test is basically twofold. What you're talking about is the most basic test is the prostate specific antigen, which is a substance made by the prostate. It's not specific to prostate cancer, but it's specific to the prostate. So a lot of other things can raise it. So we use it as a marker for potentially investigating who to investigate further. So we use it as screening, as a screening marker. And the other part of the test that urologists recommend is the rectal exam. So that is the part that scares most men.
Yes.
Coming to have a rectal exam done. Now, if you've never had it done, it takes about less than 5 minutes. I wish I could take a survey in the office and publish it, about apprehension surrounding the rectal exam before and after. Because most men, when they come in, they're very apprehensive at first. And then they had the rectal exam, they're like, what was I worried about? This is nothing, right? It takes like 5 minutes, and it's over in a jiffy. And you might ask why we recommend both the rectal exam and the prostate specific antigen or the blood test. And that's because occasionally, and this is for some of the worst cancers, even though they're advanced cancers, they don't produce PSA, right? They become so unlike the prostate and so what we call de-differentiated that they don't produce PSA. So you might have a PSA that's 1, which is normal, right? And quite good. And you have an advanced cancer, you might not pick it up unless you actually do the rectal exam. Now that is rare, but that's why most urologists, we did a survey here, my colleague, Professor Aiken, and I did a survey here in the Caribbean, and most urologists, over 80% would actually recommend doing both tests. But I always tell men, if you're going to come, do not let the test dissuade you. I would rather you come and have half a test, do the blood test, than nothing at all. And I think that's probably the way to look at it. We must not be absolute. If you don't want the rectal exam and I can't change your mind, at least do the blood test, at least get screened.
Yeah.
But I would suggest both.
And so I started there because I wanted people to look at worst case scenario, right? Because we hate that test. We don't want to even imagine it. But so I started there. So let's talk, so we could have that conversation. But let's start at the beginning. Let's educate men as much as we can while we're here today. Let's start with what is the prostate and why is it so important to men? What does it do for us?
So when you ejaculate and you produce semen and sperms in the testicles, and it's not just the sperm comes out as as part of the ejaculate. So you have a bunch of substances that are produced along the way. So the sperm, every time you ejaculate, sperm doesn't come directly from your testicles. That's a misconception. A lot of sperm and semen is stored in what we call the seminal vesicles, which lie adjacent to the prostate. And all these organs produce substances that contribute to the semen. So for instance, semen is not just sperm. It's sperm, it's different fluids, it's chemicals. If you ejaculate onto a piece of paper and you hold it like this, at first it coagulates, but then it sort of liquefies and it will fall off that paper within a few minutes. And PSA is one of the substances which does that. It's what you call a serine protease, and ACE at the end of it means it probably breaks down something. So it causes the liquefaction of the semen. Okay, so it's essential to reproduction. And it's this kind of what we describe as a walnut-shaped or a walnut-sized organ. So it's about 20 to 25 grams. And it sits at the base of the bladder. So you have your bladder, like a bowl sitting there, right, that collects urine. And then the urine pipe that runs to the outside, that runs through the penis, the prostate surrounds that. And that's why as the prostate enlarges, think of it as a donut surrounding the base of the bladder. Sure. So as you get older and the prostate enlarges, that hole in the donut that urine will flow through closes. So that's why you get the symptoms of having to strain when you pee, or weak stream, feeling like you have stuff left behind when you pass urine, because that hole in the middle is getting narrower. So that in a nutshell is the prostate. It's essential for reproduction. And it's just a little organ that sits at the bottom there, but it sits in a very complex place. A lot of nerves passing close. The rectum is right behind it. That's why we can feel the prostate through the rectum. The urine pipe flows through it. That's why you get the symptoms of the urinary symptoms with enlarged prostates or prostate cancer.
Yeah, and that's wonderful. Again, at this age, as we get into our 50s, and again, we need to start worrying about it in our 40s and start considering where we're going. But again, as we get into our elderly age, and I'm not saying we're old at this point. I'm not trying to put any labels on it, but these are things we have to consider. And I thank you for that. We need to educate people. So another thing we're kind of worried about as men is erectile dysfunction. Does this contribute any way to possible erectile dysfunction?
Advanced prostate cancer can cause erectile dysfunction. Treatment for prostate cancer is associated with erectile dysfunction. But I want to get the message out there that erectile dysfunction is treatable.
Mm-hmm. Right.
It's something that is treatable, right? So it's not going to kill you. But prostate cancer could kill you.
Mm-hmm.
So get screened early and get treated. Advanced prostate cancer can cause erectile dysfunction, but by and large, the worry with erectile dysfunction and prostate cancer is that it's associated with some of the treatments.
Right. Now, as men, we worry with the erectile dysfunction. It makes us feel we're not as men. We're not functioning as a man. So we don't want to consider it. But what I want to ask is, have we had cases come up where men go in for ED treatment to find out they have prostate issues?
Yeah, absolutely. I mean, part of every man that comes through my door as a urologist, and I wish more people would do this, gets asked about erectile function. People are ashamed to bring up this topic, right?
Right.
So they all get asked about the erectile function, and even if you come for an enlarged prostate, because some of the treatments that we can use for enlarged prostates will help benefit erectile function. Okay. So men do come in for ED, and part of the workup for erectile dysfunction. Remember, erectile dysfunction is a potential marker, and this is another thing we need to get out there. Erectile dysfunction, particularly in young men, young being in 40s and 50s, is a marker for potential cardiovascular problems. So the same clogging of the arteries that's happening in your penis that's causing you to get erectile dysfunction is potentially happening in your heart. So if you have erectile dysfunction, we usually do a panel of bloods. We look at your testosterone, we look at your cholesterol, and because of the potential treatments, we also send off a PSA, which is the prostate-specific antigen. And I always do the rectal exam as well. I encourage them to get it done. So sometimes people will come in with erectile dysfunction and then figure out they have something else. So that's true.
Yeah, and I wanted men to be aware of that, because this is what we're talking about. Look, you know what? At this age, in our 40s and 50s, young men, as you call them, thank you very much. We need.
Hey, I'm going to be there in a year here.
Yeah.
I'm going to be joining you in a year.
Again, we don't want to feel old, but these are the things that we have to consider moving forward. And we hate them so much that we put them off, or we don't acknowledge them. And then, as we like to mention here, it creates more ill health effects. And that's what we're looking to prevent here with this topic, right? With this discussion. Share, if you would, some of the statistics or some of the results that have come about through your studies and your research. So
we have looked primarily at our situation here in the Caribbean, and we in Trinidad. I don't know how much you know about Trinidad, but Trinidad is a multi-ethnic society, and we have a balance of people of Asian origin, so Indo-Trinidadians and Afro-Trinidadians, and we've looked at prostate cancer rates, and this is consistent, over 2 or 3 studies. We've looked at prostate cancer rates among Indo-Trinidadians, among Afro-Trinidadians, even in South Trinidad, which is probably more Indo-Trinidadians. Afro-Trinidadians outnumber Indo-Trinidadians when it comes to prostate cancer 3 to 1, right? So Black men tend to have a higher risk of prostate cancer, and they tend to get more aggressive prostate cancer as well, and this is a pattern. This is a pattern we've seen, 3 to 1. So, and not only were they more likely to get prostate cancer or have prostate cancer, they were more likely to have PSAs over 100, or disease spread outside the prostate, or we usually grade the prostate cancer. If you look at a report, you'll see the prostate cancer graded between 6 and 10. Black men were more likely to have higher grades of prostate cancer and higher stage. That's coming out of our study. So that's been the focus. What we like to look at more is some of the genes that are responsible for this. But of course, it's expensive. We are in a resource-limited setting, so we're working on it. We're working on it.
And are you able to expand internationally? Because again, you're talking about Asian people, you're talking about Afro people, mostly in the Caribbean environment. But you've already mentioned genetic differences. have you expanded to European or white or Indian, indigenous culture, that sort of thing, to have some research there?
We haven't, but what's come out of our research, and we should note before we go forward, is that if you're okay, so most of these North American and European studies have looked at prostate cancer screening and the outcomes. So they will take a large group of men and they will screen some of them and they will not screen some of them, and then they'll look at the outcomes and see how many lived, how many died, what was the difference between the two groups. Mm-hmm. When you look at these studies, minorities are underrepresented. Okay, so it's a large, predominantly white population, mm-hmm. and that's what we're trying to get out there. That these studies are cannot necessarily be extrapolated to our population.
Okay.
And this is why, so the Americans recommend starting screening at 55 to 69, having a discussion with your doctor between 55 and 69, because these were the groups that were included in the study. So the study looked at 55-year-olds, 69-year-olds. But here in the Caribbean, as a group, we had about 40 members of the Caribbean Urological Association surveyed, and we as a group believe that Black men especially, and we could probably say this to our brothers, anybody who are looking in Africa, or Black men in general, should probably start screening earlier. And even the AUA says this. The AUA says if you have higher risk based on family history, or if you have higher risk based on ethnicity, you should start screening earlier than 55. So for Black men, we recommend annual digital rectal examinations and PSAs.
From what? 45, let's say?
From 40. From 40.
There you go. Yeah.
Black men.
And so, Black men, do we know why? What gene or what causes this, that Black men have to draw attention to this?
Yeah, they're. I mean, it's so multifactorial, and I guess some of it we will never know, But there is a genetic component. Some of the mortality that we see in developed world might be linked to access to care, as well, with minorities. So it's really multifactorial. And I know we're looking at some research looking at the genes. And the other thing we should mention is, now that we're on genes, family history is important too, not just the males. But I don't know if you've heard of BRCA, or BRCA for women with breast cancer. That's a very, very popular one. So I don't know, men might not know this, but if you have relatives with breast cancer, ovarian cancer, you're at higher risk for prostate cancer as well. And the BRCA gene is associated with, especially BRCA type 2 or BRCA2 is associated with prostate cancer. So a lot of men don't know this.
No,
so if you have a relative with ovarian cancer, breast cancer, endometrial cancer, these types of gynecological cancers, you're at higher risk, and I think it was prudent to encourage you to get screened.
Wonderful. Thank you for that. That's a great recommendation, especially, again, I'm a 48-year-old male, and one of my aunts did pass away of breast cancer that they couldn't find and couldn't reduce.
Yeah, especially breast cancer under 50.
She was right around that age, 50-ish.
Yeah.
I don't remember whether she was over 50. I think she would have been just over 50. She was a relatively young woman. So, it does take people. And thank you for the awareness and the connection that we do have to worry about our genes, where we come from, right? In order to maintain our health. And thank you, for our Black brothers out there. Again, don't be afraid to go and have that appointment and visit your doctor, because again, this is about your overall prolonged health, right? Prolonging, a good another 20, 30 years based on when you could be taking out a good 45, where you could be 75 to 80, for a decent life. There's a lot of shortcomings that come about by not seeking proper health screening and attention for our male health, our male dominant concerns.
Yeah, absolutely.
So talk about the screening process a little more, if you could. You mentioned some things off the top of the show, and people might have been confused by that. Start at the beginning, where we think we may have something. Maybe we're not peeing properly, or something's not right. We know that much. What do we do from there?
So screening actually aims to catch you before you've even got any symptoms. So you're 48, you're asymptomatic, you had a relative with this gynecological type cancers, probably wise to get screened before you even have any symptoms. So that's screening.
Well,
And
I do
screening,
talk to my doctor, and I have conversations with my doctor regularly. Like I go for regular because I'm a diabetic too. I go for regular conversations and checkups with my doctor. Some men don't do that, right? And there's where we want to catch them and say, look, here's why you need to have conversations and deal with these checkups with your doctor because this is what could be happening.
yeah, correct. So the screening is very simple. We do a blood test, and you need to be aware that PSA is specific to the prostate, but it's not specific to prostate cancer. So several other things can cause a raised PSA test, and that includes if you have intercourse, like within 48 hours, that can cause the PSA to just bump slightly. If you've had a rectal exam or some kind of rectal trauma, that can cause it. Riding a bicycle or going horseback riding just before. So you want to avoid those things before going to your doctor to do your PSA, because that could potentially raise the PSA a little bit. All right. An infection. I've seen people come in the office with PSA of 50 and they've gotten infections. They've got a urinary tract infection, the burns when they pee, they have a little fever. We treat the infection, we recheck the PSA in a few weeks, PSA is 1. So those are the things you need to be aware of and your doctor needs to be aware of. So part 1 is doing the PSA blood test. That's just a simple blood draw, it takes 5 minutes, hardly hurts. And then part 2 is the digital rectal examination. If either of those are abnormal, then you may require a biopsy. And what type of biopsy you get depends on where you are. A biopsy simply means taking a piece of the prostate and looking at it under the microscope. Now imagine your prostate there as a, give me a fruit that you guys use in Canada. Let's say the prostate,
Apple.
we'll use an apple, right? So let's say the prostate is there as a small apple. What we will do is we'll take an ultrasound and we'll take about 12 bites of that apple. And I know that sounds horrendous, but it's much less painful than you would think. And then they look at it under a microscope and see if there is prostate cancer there. In some centers, they might send you for an MRI scan before. So if you're, and this depends on where you are. So some centers do MRIs on everybody. Some will save an MRI for after you've had a biopsy if your PSA continues to rise, or some do MRIs on a certain subgroup of people. So if your PSA or your rectal exam is raised, you might have an MRI and you might go to a biopsy. And we'll take a piece of the prostate, look at it under the microscope, see if there's any cancer there. And then depending on what type of cancer, how high your PSA is, how your prostate feels, we'll put you into a risk group. And then depending on that, we will recommend treatment for you.
Wow. And so that didn't sound like a complicated process. It didn't even sound like a fearful process, really. I know we fear the glove test, right? The prostate, the rectal exam. But I mean, I've gone for myself because I've had a gastroscopic surgery, so I've gone for these things myself. And they are invasive because yes, somebody does have to inspect you in an area you don't want people to look. But in the end, it's your health. It's somebody who's looking at your health concerns and your ultimate over health well-being. And so I'm not I'm not avoiding that. I don't worry about that. I don't can take concern for that. But there are still many men who do. Is there something we can do to help men relieve that feeling, that apprehension that we have about this?
I think absolutely. I mean, that's a great question. I think shows like this go a long way. And I think peer conversations, I think having men who've had it done actually explain what they had done, what the experience was, that it was not as terrible as they thought it was going to be, and the benefits of getting screened. So, when you see a man on the ward with advanced prostate cancer, it is a terrible way to die. I'm telling you, RJ. The prostate grows, it swells, it blocks off the urine, you can't pee, you're going to retention, you might need a tube. If you're really unlucky, it blocks off both kidneys, you're going to renal failure, which is another horrible way to die. And then it starts to spread to the bones, the liver, the lung. Some people, the bones in the back start to break, and then it paralyzes you. All this stuff is avoided by finding out early. And I think, coming back to the question, having peers talk more openly about it, rather than having this thing be hush-hush, goes a long way. And having conversations like this openly, those things also go a long way.
Yeah, absolutely. And sharing stories. Look, I was I used to drive wheelchair bus for a living, so I used to transport people to their medical appointments. And I did have a gentleman who was, I know I was transporting him for his appointments due to prostate issues. Um, and he was very, what can I say, but humbled. You know what I mean? He had no choice but to allow me to transport him, which meant that I had to get it within like his personal space, within a foot of him, right? Which means, I mean, we know his prostate doesn't work, so um, I'm smelling him, shall we say?
Mhm.
And so this is, I mean, he's trying to remain dignified and keep a smile on his face and maybe even joke about it a little bit with me. You know what I mean? So that I can feel comfortable with dealing with his situation. You know, we talk about the as men, we don't want to be put into situations that take away our manhood. And here was a situation where this man was put into that, he had no choice but to rely on me. And in order to do so, he's trying to make me feel better about his condition. Right. So I don't want men to get into that place. So I just wanted to share that story because, you know, we avoid this because of our lack of dignity, right? We don't want to be put into that place where somebody has to inspect us to this degree. But yet if we don't, we will be put into a much greater place of indignity.
Yep.
And
I can tell you this though, Richard,
sure, let's hear
RJ.
it.
I can tell you this. You're not going to when you come to urologist office, what happens in urologist office stays in urologist office. And you're not going to show us anything that we have not seen before.
Mhm.
We do not judge. So you come into the office, you have your rectal exam, you have your PSA test, and it could avoid a situation like you are describing there, or I was describing earlier. So we're a very very non-judgmental bunch of people as urologists, right? We've seen everything and we've heard everything.
Right.
You can't tell me or show me something I haven't seen before, as a patient coming to screen for prostate cancer. So have no fears about that. It's over in 5 minutes. It's not awkward at all, and it's something we do every day. And
Right.
I wish more people would get out there and actually talk openly about their experience.
Absolutely, absolutely, and we'll get back to that in a second. But and then so if I can finish my story, because he allowed me to transport him for what several months as he's going through these treatments that honestly were just to make him feel more comfortable or to keep his system flowing properly while he was alive. And then one day the phone call comes that you don't need to go and pick him up today. And that's a sad phone call to receive because um, though there's not the specific words behind it, you know what you're being told. Um, Having been in that profession, I've received that phone call more than once, um, and it's sad for me to even imagine what this person has been through. So
Yep.
I want men to understand that that's the tragedy side of it. That's the terrible side of it. This getting checked and keeping on top of your medical history and getting proper checkups is not the struggle or the stress that we allow it to be. And so seeing people like yourself, I mean, if look, if you wouldn't have to see a urologist unless you're down that road, right? Unless you've gone through your screening, you've gone through your test, you now have had your MRIs to try and compare. Now you need to start seeing the urologist to see that we have something here, right?
Yeah, so you can have a screening test done by a general practitioner, to be honest.
Right,
We get involved once the PSA is elevated. Where do we go from there?
right.
Right? So we will then take it through the biopsy process and look at the results of the biopsy, and then we'll recommend treatment. And sometimes, I mean, it's usually a multidisciplinary team. So we will involve as urologists, we might involve a radiologist, we might involve a oncologist or a radiation oncologist, depending on what the patient chooses, because there are multiple treatment options.
Mhm. And again, like I said, they don't have to get to that level if they can seek proper medical attention on a stable and regular basis. Like I seek checkups with my doctor every 3 months, right? So um, this helps prevent my medical concerns. Um, we keep my blood sugars leveled. We keep my, she gets to monitor my bloods. I don't think we have any undue concerns at the moment, but I have to be open as well in discussing what my issues are. So there's another topic that we have for our men, because we don't like to admit we have a problem. And then, being men, we don't talk about downstairs, right? We don't tell people what's going on, maybe even a doctor. And this can prevent proper medical care. So, what would you say to that? Being open, like, the topics we have to say with our doctor.
Yeah, it's not just patients. It's actually, as I said earlier, even medical practitioners. An older man can be a father sitting in front of you in your office for problems passing urine. You know, I ask them all, how's erectile function? Because sometimes this helps you to pick up the right treatment. It helps you to pick up on something that you would not have picked up on unless you asked. Right? And so a couple of things that we need to ask about. Have you seen any blood in your urine? We need to check the urine. Blood in urine is a serious thing. Could be cancers anywhere along the tract. How is your erectile function? This might be a red flag that we pick up on early. These are the conversations we need to destigmatize and actually have conversations with our doctors, and as doctors with our patients as well.
And so, what would be an environment to have that conversation? First of all, with your doctor, what would be a good, because again, we need to get men to open up. That's the topic of our regular show, is open up. But so, how do we get men to open up, at least to our medical professionals, with the proper information? Again, we like to be disclosed, but knowing from the medical point, we can't be disclosed. How do we get them to open up?
I think you need to let them know that it's okay to open up. It doesn't make you any less of a man. And we've done studies here where men had these connotations about the rectal exam that is associated with homosexuality, and a whole range of things, a whole range of barriers to screening. So we need to get it out there, and this is probably at a public health level, policy level, that it's okay. I mean, if you have celebrities raising awareness of this, celebrities that men will respect and listen to in whichever territory they're in. So if they're in Canada, they're listening to one person, they're in Jamaica, they're listening to one person. Just get somebody to get the message out there that this is okay to talk about. Have the peers tell them that it's okay, and then educate your general practitioners, educate your urologists if you have to, that you need to ask these questions. More is missed by not looking than by not knowing is something that somebody said to me in the past, and I think that's very sound advice. More is missed by not looking, than not checking fit, than by not knowing. Mm-hmm. It's very good advice.
Yeah, because we don't know. There's so much we don't know. But by just picking up a pamphlet or asking a question or open up and having a conversation somewhere. I love that you mentioned asking your peers, because we don't have these conversations out in public, right? So, I mean, I'm open to conversation. And this is September, being Prostate Awareness Month. But what about the other 12 or 11 months of the year? What do we do? How do we create that awareness? Where are we going to talk about these issues?
I mean, there are different spaces. There's different spaces. I mean, at a policy level, ministries of health in different territories can have this awareness so that it doesn't go away. You coming on a show in April and saying, guys, guess what? I had my PSA screening. It was nothing. The rectal exam was quick and painless. That goes a long way, because then people say, wait, so he's willing to say this on TV. The world didn't end. Nobody's accusing him of anything. It's okay. It's probably okay. Guess what? I'm going to go to my doctor. I'm going to do it too. So having people on board and having people that the average man will listen to, and just keep the message constant, keep it simple. Those things go a long way. But consistency with your messaging is key, and simplicity and having the message out there, in a way that people will actually assimilate it. Having somebody that they will listen to, I would think is key.
Absolutely. I love that you've said that, because again, we have you today. We have an expert who's done the studies, done the research, helped treat the patients, understands the process. So we're getting that out to the public today. And we're thankful for that. We were looking for the way to have this conversation. So thank you for you to be willing to come out and share that with people today. But I love that you mentioned people that men are willing to listen to, because there are so many men out there who have gone through this, who have screened, who have come through it, and they're better, stronger men for it. There's other conversations for another day. So I thank you for that, and I think that's something. Being a topic that's special to men, we're gonna try and keep this up much further beyond September.
Yeah.
Thank you
And
for that.
RJ,
Yeah.
there's one thing I should mention as well. If you have prostate cancer, you come with prostate cancer, the screening detected prostate cancer. A lot of people don't know that not every prostate cancer requires immediate treatment. There is a significant proportion of men walking around out there with prostate cancer, and they'll never know. They'll die with it rather than of it. So they'll die with it rather than of it. So there's a thing called active surveillance, and you can actually watch the prostate cancer. Somebody is as fastidious as you with your medical care. You get diagnosed with low-risk prostate cancer, you can watch that cancer for a number of years and only treat it. So we know that you have cancer, but we're just going to watch it because it's low risk, it's not moving, it's not spreading. We have eyes on it, and we're going to watch that for a number of years until you need treatment. So we're not going to expose you just like that to the harms of treatment without being sure that this is something that's significant. So just because you have prostate cancer doesn't mean you have to get a prostate out, you have to get radiotherapy. There are other options, including active surveillance, which just means watch you closely, only treat if it becomes necessary. So we avoid the side effects of treatment for as long as possible.
So
that's something men need to know.
Let's say somebody is under active surveillance. I think you said people die with that. So in other words, this may not something that will be inflamed to the point where it will take us over.
Correct. So the prostate cancer is graded from 6 to 10. So it's called a Gleason's grade. So if you see look at your report, you'll inevitably see Gleason's grade 6, 7, 8, 9, 10. Right? If you have a Gleason 6 prostate cancer, your PSA is not too high. It's elevated, but it's not too high. You don't have many cores. So we took 12 cores and only 2 of them are positive. You have low risk or very low risk disease. Okay? And we can watch you. We can just do your PSA. We do your PSA often, every 6 months. Every 12 months, we do a rectal exam. We might do an MRI on you or a biopsy on you in the future. And we just watch it closely. So you go about your daily life with knowing you have prostate cancer, but we don't need to treat it. We only treat it if the PSA starts to rise or something goes awry when we do our tests. So you avoid, because remember, treatments have potential side effects. So not every prostate cancer needs to be treated. So if that's a fear, active surveillance is also an option, but it's only for some men with low-risk disease.
Now, does stress have anything to do with activation of cancer?
I don't think anybody has really proven that definitively, and these studies are hard. I mean, how do you conduct a scientific study looking at stress? It's so hard to randomize something like that. It's like diet. How do you accurately assess somebody's diet? So it might. I mean, who knows? It might. And stress affects testosterone as a very complex interplay. So adequate sleep, manage stress levels are my best advice. And a healthy diet.
I ask that because people do believe that stress has things to do with activation of cancer cells.
And they might be right. They're probably right.
So whether we do know that as a fact or not, I'm glad I asked a medical professional while I had the opportunity, right? Because again, you're talking about awareness. This active surveillance means you're aware that you have cancer, and would that cause undue stress, which might cause greater activation of cancer cells? So I was trying to relate that, or as you seem to have disproved that, which may be the case, right? You just seem to say there's not a direct relation.
I'm just saying there's a lot of things we don't know. There's a lot of things that we don't know, and I can't tell you that. It just seems like a good idea that even if we don't know, why would you not want to control your stress levels? Stress affects us in many different ways in terms of cardiovascular health, male health with testosterone. So regardless, control your stress levels, get adequate sleep, lose some weight, eat properly.
Just again, you know what? Some men operate on the practice of, well, what I don't know won't hurt me, right? And we're trying to say that, look, you're stressing about this, going, oh, well, if I don't know, I don't have to stress about it. It doesn't affect me. But you know what? By becoming aware of it, it's not such an ill health effect anymore. It's not something that has to be taboo that you can't deal with, right?
Yep. And what you don't know will hurt you. What you don't know with prostate
Can't.
cancer could potentially kill you. And it's a
Right.
horrible way. I see it all the time, sadly, right? And it's a horrible way to go, prostate cancer. It's
And,
painful and it's terrible.
and so I assume that the people under active surveillance have a higher chance of success, right? Because you catch it when it's elevating and treat it as such.
Correct. So these are people who have low risk disease, and the goal is to have them avoid the symptoms of treatment, the side effects of treatment for as long as possible, but still catch them early enough that when we actually do treat them, they have a very good shot at a cure. So that's why it's not called watchful waiting. It's called active surveillance, meaning we're keeping a close eye on it, and active meaning we're involved in the process. We're not just seeing you every 2 years. We're seeing you every 6 months. We're seeing you every year, and keeping a close eye on it.
So, I mean, we've talked about a lot here. You've given people a lot of advice. You've certainly drawn attention to the need for getting this screening process dealt with and becoming aware of whether you do or do not have active cancer. And then if you have the potential for active cancer, certainly become aware of that. So you've told us a lot. You've also told us just now that what you don't know with regards to prostate cancer could kill us. So, I mean, what do we not know now that we've had this discussion? Is there anything we haven't discussed today that men need to know about prostate cancer?
I would say for men who've had prostate cancer, they need to understand how the biopsy report works, and they need to understand that there are different grades of cancer. So as I keep saying, it goes from 6 to 10. So 10 being the highest risk, 6 being the lowest risk, and then there's 7, 8, 9 in between. 7 is considered intermediate risk, and there are certain. It depends on it's somewhat complex, and it depends on when the pathologist looks at the gland, how good or bad the gland looks. So men need to know how to decode the pathology report. They need to know which risk group they're in, and they need to know what treatments are out there and what treatments are experimental. They need to know that if you have cancer that needs treatment, you can get radiotherapy, you can get surgery, and radiotherapy has different types of radiotherapy. And if you have advanced cancer, these are the treatments that are available if the cancer spread outside the prostate. But prostate cancer now has become so advanced, and different treatment options coming up every day. But the backbone of curative treatment is still surgery or radiotherapy. There are other therapies that are not mainstream as yet, such as focal ultrasound or cryotherapy. They are not part of a lot of guidelines as yet, but they might be in the future. But the mainstay is still surgery or radiotherapy. And then for advanced cancers, there are a range of options that are even beyond the scope of this show that are available now.
So, of men who come forward to seek treatment or to seek testing or screening, how many of them are elevated on the scale? How many of them have advanced cancers?
In Trinidad, probably about way more than we would like to see. Probably a 30% or more have PSAs that are elevated. We're way more than we would like.
Yeah, and I'm glad that you said 30% is way more than we would like to see at this point, because some people would look at that and say that's a low number, right? But let's face it, we want to prevent this at all costs. And by coming through with that early detection and that screening process, we can certainly reduce that number, hopefully down into the low 20s, if not lower than that. And hopefully, not to say that we could ever eliminate this in the near future, but I mean, that's the goal, right? That is really the ultimate goal. I mean, we want to eliminate cancer, but certainly, as you mentioned, men's prostate cancer is a treatable disease.
Yeah, we would like to see with more widespread organized screening and a gradual, what we call stage migration. So instead of having late stage, you tend to go earlier stages. So we would like to see a stage migration in our territories. And I talk to I have lots of friends so Caribbean Urological Association is closely linked with the Pan-African Urological Association, or PAUSA. So I have very good friends in West Africa, and even in South Africa as well, and North Africa, and they say the same thing. So we would like to see a stage migration of prostate cancer in these regions.
So explain that for us, please. So for people who aren't in the medical profession, what do you mean by stage migration?
So right now, if you're in a country that does not have PSA screening, you're going to see, and my older colleagues here in Trinidad tell me that in the 90s and 80s, you saw these men with advanced cancers because they weren't picking them up. You were walking around, there was no option for screening. We didn't know that you had prostate cancer. But with the advent of PSA and PSA becoming more available, and if we were to actually get a message out there and get men to screen, you stop seeing as a percentage. So if you had 100 men with prostate cancer before PSA, and if you don't have widespread screening, a large percentage of them are going to be high stage. So PSA is over 100. You feel the prostate feels hard and craggy. But as you get PSA and men go screen, they're going to catch these things early. So there's a stage migration, meaning that you would have picked up men in stage 4, you're now going to pick them up in stage 1. So you get a migration towards less stage 4 and more stage 1. And that's a good downward trend to have. So that's what we're hoping for.
Right, and there's where it becomes treatable and not
That's
such
correct.
a concern for men anymore. It's not so much. It's kind of like treatable like the flu at that point, right?
Correct. I mean, there are a lot of treatment options, and I mean, in these two-tier healthcare systems, there are treatment options in the public sector as well. So men can access care here in Trinidad and in most other Caribbean territories for free with the government sector. And I know that's the situation in Canada as well.
Yes.
So they can access care for free. So something that's treatable and multiple different treatment options available. So that's my message for today, man. Get screened and encourage your friends to get screened. And especially if you have a relative with prostate cancer or one of these gynecological cancers, you're probably at higher risk. You're Black, you're at higher risk. Get screened, and catch it early.
And knowing your family history, like you just
Knowing
mentioned,
your family
absolutely. You've made me aware of that today. I know that if you have a higher family history of things, you do have a higher concern for yourself. But it's not something I ever concerned or worried about. Never thought I'd have to pay attention to. But I'm getting to that age, and now knowing that I have. I mean, my father, my grandfather, and my aunt both had cancer issues. So chances are there's a good chance something may come up for me, and I have to be aware. So I have to be on that early detection system. So that's what we're talking about. Yeah, that's what we're talking about here for our men. So again, you've left us with a lot of information. So a couple of questions I like to ask on our open up show. And now we got a few minutes to ask these questions here. And of course, relating to men's prostate cancer. But the questions I like to ask on our open up show are, what can our young men and boys do to empower themselves?
You mean in a general sense?
It is in a general sense. Whether you want to relate it to your topic of interest or not, what is your response to that question? What can our young men and boys do to empower their lives?
I think education and passion for what you do, and recognize that not everybody's going to be a doctor, and not everybody's going to be a lawyer or an engineer, but just be passionate about what you do. If you're going to, whatever you do in society, be passionate about it. If you're going to be, if you're going to dig ditches, be the best ditch digger, be the guy everybody comes to dig ditches. If you're going to be a doctor, try to be the best doctor you can. And if you can, educate yourself in whatever you do. So if you're a doctor, read around your profession. If as a young man, my advice is education. I think that would probably be my biggest piece of advice. And as you decide what you want to do, be passionate about what you do and try to seek as much knowledge as you can about what you do. That would probably be my biggest piece of advice. And just don't let people put you in boxes early on. I mean, I hate seeing these standardized tests where children as young as 12 are told, "Oh, you're going to do a test when you're 12, when you really should be playing with your friends, and then we're going to put you in, you know, in this school as the best school, or we're going to put you in this school that's not as good a school." You tell that child they'll never amount to anything, and I don't know that I agree with that. That happens here a lot. They write an exam at 11, and the children with the highest marks go to the best schools, and the ones with the lowest marks go to the worst schools. Guess what? I'm betting you, if I had a good, now that I'm actually formally taught to teach at a university, if I had a good teacher, I could get that child that is the worst school, I could get him up to the point where he could have gone to the best school with the right tutoring.
Yes.
So I hate seeing people put into boxes from the time they're early. Just understand that just because you were told this does not make it true. Pick something you want to do and be passionate about it, and just try to be the best at it.
Absolutely. Thank you very much for that. That's some great advice. So then finally, the last question would be, what can we as a society do to help empower our young men and boys?
Support them. Support them. Let them know it's okay to talk about the problems. Let them know that they're not the only ones struggling. There are other people struggling out there. Let them know that failing is a part of life, and it's not going to define you forever. How many people on the way to the top have gone through so many challenges to get there? People don't see that. They just see the guy at the top. They don't know all the hurdles and the gauntlet that you have to run to get to the top. Even us, they see us as urologists at the top there, doing things and giving advice to patients. They don't see the sleepless nights and staying out late and coming out in thunderstorms to see patients and the reading and so on. So life has its challenges. Support the young men, support them, let them know that it's okay to fail occasionally, and that it makes them, you learn from your bad experiences. And don't give up on them if they make a bad choice. Once it's not egregious, don't give up on them. Show them the right way.
Mm-hmm. That was Sati Persaud. Do you have any other advice to share with us before leaving today? You've been a tremendous guest so far with some valued information. What do you have to say before you part us today?
I would just like to say thanks for giving us a voice. As you say, this is great what you guys are doing, and we should continue it. Would like to encourage men to have this conversation with you don't have to have a conversation with urologists. Have a conversation with your general practitioners. Let them know you want to be screened, that you're the right age. Tell them your family history. Find out your family history. Find out about the men in your family and the women. And if you have to do it, just go and do it. And when you've done it and you've been through the process, let other men know that you've been through the process and that it wasn't as bad as you thought it was going to be. So that's my message today. Get out there, get the word out, get screened.
Absolutely. Thank you so much. Yes, we dread these experiences, sometimes undue dread. We make them out to be something they're not. And hearing from a professional like you has been beneficial. But also, I think hearing from the peers out there could go a long way to help them
absolutely
be comfortable in experiencing the journey themselves.
Yeah, hearing from somebody who's been through it, hearing from me might not change their mind, but hearing from the brother or the neighbor or the friend or the guy at the gym, tell them, hey, things nothing. I went and I did it. It's 5 minutes. That makes a difference.
Yeah, absolutely.
How many people did Katie Couric help when she had that? I don't know if you remember that. That was a long time ago. I think she had a colonoscopy on TV for colon cancer. Stuff like that is what we need for prostate cancer.
That's exactly what I was thinking when you mentioned people that men will listen to. There are certainly a lot of other voices out there who have gone through these things themselves that men will listen to. So thank you for that.
All right, RJ. Thank you so much.
Thank you for joining us and sharing valuable information with us today. You've been a tremendous guest.
Pleasure. Take care.
Thank you. So, as many Canadians know, our Indigenous communities are in big crisis right now and they need our help and support. So we at Voice of Men 360 have stepped up to start a donation drive for Indigenous families. If you have used clothing, dried food items, or any other goods you feel are good for donation, please let us know. We're working to collect them. You can reach us through phone numbers 416 356-7414 or our phone number at 437-889-8329. Email us info@voiceofmen360.com .org. Or contact us through Facebook Messenger and we'll work to coordinate those items with you. We have several live shows that we participate regularly here. Open Up, where I am the host and facilitator of a live talk show every Wednesday at 6 p.m. or Sunday at 10 a.m. Eastern Time, where we ask people to share their life journey with you. We also host Bili, which is a Tamil language live talk show, meaning I. That's on Sunday mornings at 8 a.m. Eastern Time. We have a monthly webinar. That's the first Saturday of every month at 10:30 Eastern Time, where we bring expertise in organizations to discuss a particular topic each time. You also just participated in our special discussion this week, or this Saturday, 10 a.m., called Prostate Cancer, the Nuts and Bolts. So please thank you for that, for joining us for that. We also have a special monthly show called The Unspoken Tears. That is the second Saturday of every month from 10 a.m. to 11 a.m. Eastern Time, where the focus is domestic violence against men, bullying, male sexual abuse, traumas, and human trafficking. We also co-host with the All Bengal Men's Forum. We host the South Asian Men's Show, which of course deals with issues faced by South Asian men and creating awareness for those. This is the third Sunday of every month from 11:30 to 12:30 p.m. Eastern Time. And then we turn all of our content into podcast episodes. Please look for that on all of your favorite content, Apple, Google Play, Spotify, and more. And then we have a monthly men's group. The first is a monthly men's only men for men group. This is every 2-week Tuesday from 6 p.m. to 7 p.m. through Zoom. We also host an Indigenous peer-to-peer support group called Pass the Talking Stick. This is the fourth Friday of every month from 6 p.m. to 7 p.m. through Zoom. There are no limitations with gender, age, nationality, or ethnic groups. All walks of life are invited to participate in our programming. If you want to be a guest of any of our shows or willing to be a part of our organization and help us, whether directly or indirectly, please reach out to us. We'd love to work with individuals, professionals, experts, community organizations, associations, corporations, governments, NGOs, businesses, and more. You can reach us at 437-889-8329 or email info@voiceofmen360.org, which makes our website www.voiceofmen360.org. And you can find us on all your favorite social media platforms: Instagram, LinkedIn, Twitter, TikTok. Don't forget to like and subscribe on YouTube for more. And then visit us at facebook.com/groups/voiceofmen360.com. We're also running a special campaign to increase our membership. So let us know. Let people know out there of the tremendous work we're doing to raise the voice of men around the globe. We're on a mission to drive our membership to 5,000 members by International Men's Day 2021. That's November 19th, so less than 2 months away, to raise awareness and nearly double our membership so that we can help raise the voice of men 360 around the globe. Thank you for joining us today on this special program regarding prostate cancer. Please join us for more. We want to reach out and help more people. Please continue your support. Thank you for joining us today. Until next time, I'm Vice President of Voice of Men 360, asking you to open up.